Dr. Tom Roselle live right now. 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. I'm live in studio today on this Super Bowl Sunday, and we actually have a lot of things that are going to correlate with that, but hopefully we can help you more importantly. We're here at 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject you have in mind. Perhaps you've tried, you've applied, you've gone everywhere and searched high and low, and you still can't figure out what's wrong with you. Well, this is why we're here. This is the time for you to step up and call us and find out how can you be helped without drugs, without surgery, in addition to all the other things that we're going to talk about today. We have a very, very special program to discuss with you, one that unfortunately is going to talk about a set of symptoms that are progressive within our society and unfortunately misdiagnosed, in my opinion, in many different ways. And what we're talking about is Gerd, Gastroesophageal Reflux Disease. And we're going to pick that apart, and we're going to tell you what it's about, and we're going to try to put the fire out, if you will, on some of the misconceptions, but also help you put the fire out in your stomach and your chest and all the symptoms that are associated with that. In studio, I have a very special guest, a colleague, that is going to help me discuss that, and we're going to try to make sense of this for you, because so many of you are on medications that are making matters worse, but you just don't get it, and we're going to try to enlighten you today. In studio, Dr. Scott Lamp. Good afternoon, Dr. Scott.
Good afternoon, Tom.
We are going to enjoy the unveiling, if you will. We're going to talk about Gerd, Gastroesophageal Reflux Disease. There's so many people that have been diagnosed simply because they have pressure in their chest or pressure in their back, or they can't get a deep breath of air, the combination of the two. But the problem is that's not Gerd, and more importantly, they're put on medications that make things far worse as time goes on. So what we're going to do is this. You and I are going to talk about this, and this Wednesday evening at the Roselle Center for Healing, you're going to be doing a special event on Gerd, presentation on the whys and the hows and how people really can end this problem, because it is a nasty problem. It's one that not only is painful, but is causing severe symptomatic endocrine problems elsewhere. So Wednesday night, the 8th of February, 7:30 p.m., you're going to be in the office. You'll be our presenter, everybody's host. Give us a call, 703-698-7117. Tell my staff that you'd like to attend Dr. Scott Lamp's presentation this Wednesday evening. By the way, remember, all of our in-house programs are at no charge to you. We do this as a public service, and we want to help you. That's the whole purpose of what we do. We're in practice to help as many people as we possibly can without drugs, without surgery. So this is your opportunity, but we do require a reservation, so give us a call. Scott, let's get started. We got so much to talk about in so little time, unfortunately. What's Gerd?
Well, Gerd is actually talk about reflex back of the acids in our stomach. We have this sphincter we have this tube in our mouth. We chew our foods, goes down the esophagus, goes to this part of the stomach. There's a sphincter. There's a closing. There's a hatch. And that's supposed to close off after the food gets dumped, to close it off so nothing reflexes or comes back or fluxes back into it. The problem is the tissues around the esophagus before it gets into the stomach is a different type of tissue that's in the stomach. The stomach actually can take some of the irritations of that acids that's there to help break down foods. But unfortunately, if this flap opens up, fluids regurge back into it, and all of a sudden you've got some irritation in that lining. And the problem is on at least on the medical side, if that gets really irritated, continuously get irritated, then you can also have problems even as far as bad as cancer.
Well, the misconception is that we got to put the acid out. The truth of it is, your stomach has to have acid.
Correct.
It can't be dry, because if you don't have acid, you can't digest things. You can't digest protein. You can't digest calcium. You can't absorb vitamin B12, other types of minerals as well. You have to have that acid, and it's really acidic. It's like 3, it's even
1 to 2 sometimes.
1 to 2 sometimes.
Yeah.
I know it's very caustic, but it's meant to be that way. You can't put the fire out. But the mechanics of that whole area is misunderstood. You've got a lot of things that are contributing to the opening of this valve. We call it the cardiac valve, the cardiac sphincter at the top of the stomach. And we have this leakage, but it's not always, and I have to put this in the beginning, because it's not always acid. It's the opposite. It's alkaline. It's because if you take your garden and you put acid in it, or if you take your garden and you put too much alkalinity in it, both ways is going to become imbalanced.
Right.
Same thing with us. If you have a garden, folks, and you've put alkaline lye out in your garden to try to make it better for the next year's planting, you'll find if you put too much, you're going to burn your soil. You're going to burn your plants. Same thing with the body.
Yeah. I think one of the things, too, is when you want to talk to people about nutrition in itself, you got to get things into the body. And you can't get this stuff in the body. You've got to break it down. You've got to get those minerals that you're talking about, the minerals and the proteins and everything else goes there. And a lot of the symptoms that we show, we're going to talk about decreased acid, a lot of the symptoms start showing up, like my nails become brittle. They break. My hair starts falling out. I've got some weak muscles. Osteoporosis starts falling into this because I can't break the calcium down because the acids are not there.
Protein and calcium problems.
There is a consequence to what we're doing here. And what's also interesting, too, is sometimes with that valve, when we put protein in the system, it initiates acids coming out of the stomach, which has a neurological connection that makes the sphincters close a little bit tighter. So we can even start talking about some of the high carbohydrate diets that could actually influence this because of what we're eating.
Well, carbohydrates, as we know, are highly acidic, and we're looking at things. Your body has to stay alkaline internally. Now, we're not talking about the stomach. We're talking about the blood system. We're talking about tissues and so forth. But the stomach has to be acidic. The mouth has to be alkaline. The intestinal tract has to be slightly acidic. But the blood and tissues have to be alkaline. And when you start putting in my mantra, sugar, sodas, coffee, teas, fast food, fried foods, alkaline, gluten, guess what? You got acid.
Right. And
the acid begins to burn. You know, the other piece of this, I'm just going to throw it as a side because that's the nature of who I am. This is a $10 billion a year business just in drugs. Just in drugs that are being put out there, $10 billion. And diagnostically, a physician says if you had any of these symptoms twice a week, just twice,
Gerd.
You've got Gerd.
Right.
And unfortunately, as far as I'm concerned, somebody's thrown a lot of BS into the corral.
Well, there's actually now something called Gerd, G-E-R, which is actually just having it without the 2 times a week. So now that's actually being labeled.
Good. So what's that?
That's the same thing, a reflux, but it's not happening twice a week.
You know, how often you get heartburn? Well, is it heartburn because you ate too many tortilla chips? And, by the way, we were talking on the way up today. Today,
it's the Gerd bowl.
It should be the Gerd bowl instead of, right. So this is a pure structural, chemical, emotional afternoon. And it's going to kick in the stomach acids like nobody's business.
Right, you bet.
So, the chips and the salsa and the hot dogs and the alcohol and the cigarettes and the cigars and all those things, you're going to burn like crazy. But, Scott, let's get back to talking about the mechanics of this thing, because that's really as important as, the side effects. And later on we're going to talk about the damaging effects if it's not taken care of. But, the pain in the stomach, the nausea, the headache, the chest pain, all these things physicians say are Gerd. Well, maybe. The jury, as far as I'm concerned, is a little bit too soon to its conclusion. However, talk about the mechanics. You talked about the stomach, you talked about this valve, you talk about the incompetency of the valve, but there's a whole lot of other structures that surround this valve.
Right. Well, you got to look at, one of the things, you got to look at the nervous system. One of the nervous system and how it affects. When we talk about the nervous system, even on sympathetic and parasympathetic reactions, when we're in a parasympathetic state, it's kind of like we think about sympathetic. You usually hear fight or flight response. You need to, you need to go away, run away from danger. But then this parasympathetic is rest, digest, and those things help close those valves up. But if you're in a constant sympathetic state, you can actually start losing the tone of those valves that hold things, or sphincters that hold these things closed. So, like we talk about our triangle of health that we talk about in our office all the time. What's mental, the other one's nutritional, the other one's structural. The mental part of it plays a major portion with this. And learning how, and when you see some of the treatment protocols for this, is actually to relax the body down a little bit to some extent and try to get out of that sympathetic state.
There's a big muscle that cuts our body in half, which we've touched upon, the diaphragm. And this muscle has openings, and the circulation for the lower part of the body goes there, the esophagus goes through it, and underneath this diaphragm on the lower side, we have the stomach, we have the liver, we have the gallbladder, we have all of these digestive organ systems. Above it, we have the heart and lungs. That muscle is like any other muscle in the body.
Right.
It has a nerve from the cranium, from the brain, that goes down and touches it. It's called the vagus nerve. It has nerves from the middle of the back. They're parasympathetic, meaning automatic reactors in the body, and they're called splanchnic nerves, but that's neither here nor there. But that's what causes it. But when that diaphragm, that muscle, is not working, we got a problem. And an interesting statistic that I came across is that 75% of the people who have been diagnosed with GERD have a beginning stage or a full-blown stage of a hiatal hernia.
Right.
And so that's putting pressure on that sphincter. It's squeezing it. So it's popping it open mechanically and neurologically, as we've talked about.
Yeah.
How is that?
Well, I think one of the things you look at is that what happens is that this stomach actually gets pushed through. Like a hernia means to push through something. And so it's actually going up through this diaphragm wall. And what happens is, think of it like a door that closes, and it's balanced well, it closes well. But then if you've got something that's distorted, if you don't distort the door, it doesn't close, and all of a sudden this valve doesn't close the way it's supposed to, and you get spillage. There's a couple different of those types of hernias. Hiatal hernias is a rolling one. There's a sliding one. And then also, another muscle you should talk about here, which attaches to the diaphragm, is the psoas muscle. This is a muscle that's actually your hip flexor, and a lot of times they talk about how making GERD worse is actually bending forward and those kind of things. If that muscle is contracted, it's pulling down the umbrella, the diaphragm, to some extent. And then if you're in a sitting position, for example, and those people that are obese and extra weight, pregnancy is another thing, if I sneeze and cough, I'm putting a lot of pressure with that stomach up against the ceiling, and I can push that right through. So a sneeze comes out at 100 miles an hour. And I'm sitting and I'm in an awkward position and I'm bending forward, I can push that stomach. I can actually push that up in through that diaphragm and cause some of these problems.
You know, the interesting thing that some people, physicians particularly, don't correlate is somebody who has gastroesophageal reflux symptoms, or we're not even going to call it disease, but symptoms, diaphragm symptoms, hiatal hernia symptoms, often have hip-related pain as well at the same time simultaneously. And it's because of the muscle that you just talked about. That psoas muscle comes down from the upper portion of what we call the low back or the lumbar spine, attaching to the diaphragm, comes all the way down and inserts in the hip. And if that muscle is not balanced because there's neurological irritation to the nerves that go through it, or any of the nerve roots and the muscular systems we've talked about, the hip's going to hurt too, because your normal mechanical gait's not going to work. And so when we look at a patient with GERD, we've got to look at many pieces. We've got to ask the questions: have you had any injury? Have you ever been in a car accident? Have you had bad dental work? Have you had any chest pain that's unassociated with heart disease? And it goes on, and you find that there is a correlation. Also, dietary imbalances, other than the acid foods we're talking about, not getting enough magnesium, not getting enough calcium within the body, also can cause the symptom process to come about.
Yeah. I think another thing, too, is, we're talking about different parts of the body. The diaphragm, C3, 4, and 5, keeps the diaphragm alive. And if you get some whiplash injuries...
He's talking about the neck now.
About the neck.
Yes.
No,
cervical spine.
Jumped ahead here.
Yes, you do. Sometimes.
Sometimes. But C3, 4, and 5, the areas in your neck, is a lot of times, if that gets irritated, you irritate that the vagus nerve that comes down to that diaphragm, and then all of a sudden, what happens when you irritate a nerve? Things get spastic.
And you got a problem. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live, broadcasting to you from 105.9 FM and AM 630 WMAL. You can reach us at 888-630-9625, 888-630-WMAL. Want to remind you, at the Roselle Center for Healing, starting tomorrow, this week, the 6th of February through the 11th of February, we are hosting something called Have a Heart campaign, and what that's all about is simply this. We are raising food and money for the food shelters because supplies are low and they need our help, they need your help. If you've been thinking about coming in to get an examination after listening to us all these years, and you want to see one of my acupuncturists or one of my doctors, you want to see Dr. Lamp, we're going to exchange with you. Here's what the exchange is. Our normal consultation examination fees begin at $225 and up. And if you would like to come in and have an examination with our doctors, we're going to waive that fee. No charge to you. But what we are asking you for is either a bag of groceries or 2 or 3, or a $50 donation, equivalent of each other. All you got to do is call my office, 703-698-7117. Tell my staff that you want to participate in Have a Heart Week. It'll give you the opportunity to have a consultation, a full examination with one of my doctors. Actually get 2 visits out of that, because second visit, they're going to take a look at all your results, and they're going to go over them with you. So just for an exchange. We need your help. But this is a triple play. Roselle Center for Healing is going to match your donation. So if you give a bag of groceries, we're going to figure out how much money is in there, and we're going to write a check for it. And we're going to figure out, if you donate, we're going to match that up to $100. And we're going to do that 3 times. Roselle Center for Healing is going to do it. Caring for Others is going to do it. And I'm going to do it. So we're going to make this as big of a deal as we possibly can. Please help us. Have a heart. Call us at 703-698-7117. And this Wednesday, February 8th, if you'd like to attend Dr. Scott Lamb's presentation on Gerd, all you got to do is call us. Need a reservation? Again, 703-698-7117. Dr. Lamb, we have a lot of calls coming in.
Okay.
And, I was going to start the next step with you, but let's go to the phones first. Alice, thank you very much for calling. How can I help you?
Yeah, hey, how you doing? I just tuned in. Actually, I'm 46, and I actually lost a lot of weight last year just by being healthier, and I jog now. I lost 50 pounds. I suffer from depression, but I had acid reflux before the weight loss, and sometimes I get a little bout of it, but I don't take the meds anymore. Can that be? I had 2 really bad ear infections over the past 3 months, and my doctor told me I had a scarred tympanic membrane. So I'm kind of concerned, could my stress and anxiety be causing something while I'm sleeping, creating a problem with my ears?
No, it's doubtful. The ear infections and the acid reflux are not. They're not only for one thing could be the linkage between the two of them. If there's any neurological pathway problem, Dr. Lamp, before we broke for the break here, talked about the cervical spine, the neck, cervical 2 and 3, having a nerve that goes to the stomach. Now, that nerve, those areas also influence the neck and the ears and the like. So if you have pinched nerves in the neck area, you can decrease the flow of the eustachian tubes. These are the tubes that balance the ear itself, and subsequently you can build up fluid and you can have infections and so forth. Unfortunately, ear pain and pressure is not always an infection. It can be just the body's inability to eliminate fluid. It can be a fungal problem. It can be a lot of different things, but the two don't necessarily go hand in hand, except for the linkage between the nervous system.
Do you think the jogging is something that's causing the infections?
No. I don't either. No, your immune. First, you look at neurology and see if the neurological system is working to trigger your immune system response, making sure that your antibodies are working the way you're supposed to. Second, you look at the chemistry, all those things that you eat you shouldn't, all those things that you need more of that you don't get enough of, and you have to make sure if you're eating anything that is a fast reactor, sugar, sodas, coffee, black teas, fast food, fried foods, alcohol, gluten, additives, preservatives, those things all will cause your body's immune system to decrease. Subsequently, you're going to be more susceptible to bacteria, microorganisms taking over in your body.
Okay.
But having said that, you got to look at the whole system. It's just not, your day that somebody decided to go after you. Alice, I appreciate it. Thank you very much for your call.
Thank you so much.
I hope that helps, and if we can be of help to you, please join us and join Dr. Scott Lamp this Wednesday evening at 7:30. Richard, how can we help you?
How you doing? My infant, he's 3 months old, going on 4 now, and he's had GERD since he was born. A couple weeks after he was born, he got diagnosed with it, but he didn't have a ultrasound or.
How did he get diagnosed, Richard? How did they diagnose him?
Through the symptoms.
Okay, that's it. At 3 months old, that is the craziest diagnosis that any physician can come up with, period. A child at 3 months old does not have GERD, period. End of story. They can have reflux. They can have all kinds of things. That can be handled, but that child does not have GERD. And in my opinion, a physician that puts a child on Xanax at that age is out of his mind.
That's what happened. They put him on Xanax, and he's been on it for 2 months now.
Yeah, no, there's better ways of doing that. Let me tell you, you give our office a call, you can make an appointment with our pediatric specialist, Dr. Jennifer Sims, and have her take a look at your child. There's better ways. There's things that can be done. You want to light my fire? This is a good way to get it done. As you can tell, I've got a real hot spot for any physician, just automatically putting the child on a protein pump inhibitor just because. A child at that age does not produce the acid that you produce. They have other problems that are causing that esophageal reflux, that projectile vomiting in some situations. Yeah. But you don't give a child that type of medication, period, end of story. Richard, give us a call. I would love to talk to you about this more extensively because you got to do something about it. It's criminal.
Yeah, that's can you give your number?
703-698-7117. Ask for Dr. Jennifer Sims, and she'll call you back. And if we can do something for you, and if you'd like to come in this Wednesday evening, we'll talk a little bit more intimately about that. Richard, thank you very much. I appreciate it. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live. We're at 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject that you have in mind, and I have my opinions. My guest in studio, Dr. Scott Lamp. Hi, Scott.
You sure you want to work on something on blood pressure right now? Or
wow. What? Yeah, I know. I need to be calmed down a little bit. But, they hit the right button. Kids and the ridiculousness of the arbitrary of prescribing drugs that they don't need when there's other things that can be done that are far more effective. And I can't do this again. I got to slow down.
Yeah.
Call me on something else. 888-630-9625.
Deep breath.
I know. We're talking about Gerd, Gastroesophageal Reflux Disease, and after that last, maybe I got the problem too. But if you're taking things like Acifex or Nexium or Prevacid or Protonix or any of those things, this program is about you, and this program and Wednesday night's program that Dr. Scott Lamp is going to be your host and your presenter is simply on Gerd. If you'd like to join us, if you'd like to join Dr. Scott and ask him any question that you have in mind, 703-698-7117, 703-698-7117. I want to remind you that all the programs that we do in-house are part of our in-house continuing education program, and they're free to you. It's a public service. We would love to educate you in any way we possibly can. All you need to do is pick up the phone and call us, because you do need a reservation. And we only have the capacity for about 40 people in our classroom. And if we have more than that, we'll do it twice, but nevertheless, we still need to know. So give us a call. You're going to enjoy Dr. Scott. He's got tons of information. Let's talk about this problem because, as you know, it's one that, as far as I'm concerned, is treated improperly. And in your practice, you see it as much as I do. We talked about the mechanics of the stomach. We talked about the acid going into the system. Take it the next step, Scott.
Well, I think the other thing is some of the chemistry aspect, because right now what they're thinking about, if you're going to have acid that's going to be burning, we're going to have some type of antacid. You have to have some H2 inhibitor. You're going to have some proton pump inhibitor, something that's going to cool everything down. But again, on the other hand, we're also, on one side, we're thinking we're helping. In the long term, we're causing all kinds of major problems along the way. And there's ways to kind of calm some of these things down. I think we talked about chemistry before with, the body will respond. And it's an interesting thing, and I brought this up to you, I think, one of the first times I was working in the office with you, Tom, was the aspect of, digestion starts with, first you smell it, the body smells it and senses it. You chew your food, and it tells you what's coming down the pipe. And it's kind of like, my analogy is similar to an uninvited guest coming to your house. If all of a sudden they just show up, what do you do with this person? It's the same thing when you chew your food. You want to chew your food. The body wants to know what's coming down there. Protein actually helps increase some of the acids in the stomach. And if you have a high carbohydrate diet and a low protein diet, that can have some effects on it. That's one of those aspects.
There's an interesting study that came out of Europe, and this is what we see often in our practice. They took thousands of patients, and what they found is 66% of these people had no presence of damage in the esophagus or in the stomach due to the supposed presentation of what we've been talking about. You know what they called this thing? NERD. N-E-R-D, NERD, right? Non-erosive reflux disease. Well, that kind of shoots it in the foot or other parts of the body, because if it's non-erosive and it's not there, How in God's name can they diagnose it, number one? But this is what we're talking about, things being way too alkaline, or just pressure on the chest,
right.
or people eating the wrong damn foods, like too much gluten and the things that
right.
they shouldn't be putting in your body anyway.
Yep.
And this is the beginning stages of all this stuff. And they put these people on all kinds of medications. You know, they put them on the protein pump inhibitors, and they say, well, you're going to have to take them for the rest of your life. And I sit there, and when I hear, well, my doctor told me I have to take this thing for the rest of my life, my baby green eyes go through the red stage, and I get nervous. I've known to do that before.
Mm-hmm.
However, you know, we see that with nerve root pressure. We've seen it with people eating the wrong things. We've seen it with allergy reactions. We see it under stress where the stomach just tightens up. It's not about your stomach producing way too much of the stuff. Anyway. Having said that, we have another call. BC from Fairfax, how can I help you?
Good afternoon, gentlemen. I can't tell you how much I enjoy your show every weekend and your approach to the medical problems that we have out there, and I don't understand why this is not more mainstream in the medical culture, but you guys know more about that than I do.
Thank you.
I'm the world's biggest skeptic on many things, but as I told your call screener, I've been wearing one of these wristbands. I believe this one has titanium in it. And I'm a very active person, sporting-wise, as well as in my job. I'm in construction, so I don't sit behind a desk. So I know where I ache and pain all the time and know where I don't. And I've even noticed at night now I seem to even have clearer sinuses.
Since you've been wearing the band?
Yes, and I've been able to breathe better, as well as I still have pain. I just turned 60 years old, so I'm not a spring chicken, but as I say, I'm very sensitive to where I have pains in my body, in my hip or my knee or one thing or another, and I have noticed an appreciable change. It's not gone. I don't expect it to be gone.
What's the band made out of?
It's actually rubber just with a little insert in there, and I believe this was a titanium. I don't want to give a brand name if you don't want it.
No, I know exactly what you're wearing. There's a couple things with it. There's a good piece and there's a bad piece to it. There's an electromagnetic piece that's in that band. It's the one on television where they try to pull you over and they put the band on and you stand more stable. I haven't seen that. Okay, there's one out there like it. If that's the one, because it has an electromagnetic pulse, you may be influencing the acupuncture energy that is flowing through your hands. Acupuncture points either start or end on the hands or feet or the face or the chest. And there's a lot of them on the hands, and they affect different body parts. So if it's causing a balance of energetics to occur, then the wristband that you're wearing is going to make a significant difference. It's not the titanium. It can, if it's copper, in low-level copper, that may help a balance. Those are things that were used years ago for arthritic problems. So it depends on what it is. Now, if it's the one I'm thinking about, and it may not be,
it begins with a P.
Okay, we've tested them in the office, and what we do with patients is we test a strong muscle, and then we take the wristband and we put it over the center of their chest, and then we retest the muscle again. And what we're finding about 80% of the time is that these muscles that were strong to begin with, when we put the band back on their chest, it weakens them immediately. So there's a good piece and there's a bad piece to it. So if you haven't noticed anything except for positive reactions, then I'm not going to tell you to do anything about it. But if you've noticed anything else has changed, your gait has changed, your ability to run distances have changed, your endurance at any level has changed, you need to have that thing looked at, and I would take it off. But again, I'm not sure that we're talking about the same thing. But if it's helping you, I'd be the last one in the world to tell you not to wear it. If it's something that you're noticing that there's some benefits to it, but there's other pieces that are starting to change, perhaps not for the best, then I would be very careful of it.
Well, I haven't noticed any derogatory side effects, is what I'm saying.
Then don't worry about it. Mm-hmm. Okay? Hold on.
So these things are somewhat for real, you're telling me.
Well, the other thing I've got to chime in here a little bit, too, is one of the aspects on that is also a matter of time. I mean, sometimes some of these things that people use, they'll see immediate benefit, but when the body starts to balance to it, sometimes it overdoes it. So it's just kind of see how you do in the long term. So
right. Well, I was initially just wearing it when I played golf, and I took it off. Then a few weeks ago, I just put it on. I left it on. As I say, it's rubber, so you can wear it in the shower and everything else. And this is when I noticed it. And then that's funny you say that, because I'm thinking, okay, well, let's continue to monitor this and then see if things start going the other direction.
Yeah, I was going to say, use your body as your own laboratory. Take it off, see what happens. And it could be coincidental with some other things as well. So, send me a note on email, and I'll go back and forth. It'd be an interesting experiment to do, and the data I'd appreciate so I can have it for other people.
Surely would. Okay, very good. I certainly did that. What's the email again? rosellecare@aol.com, or simply go into our website at rosellecare.com, and you can go straight through that. Very well. Thanks so much for the information.
Yeah, you're welcome. Thanks for calling. Appreciate it. This Wednesday evening, Dr. Scott Lamp, my host in studio, will be your presenter at the Roselle Center for Healing. He's going to be talking about Gerd, the subject that we've been touching upon today, Gastroesophageal Reflux Disease. If you're taking all these crazy things from Prevacid to Nexium to Protonix, and the list goes on and on and on, this is your opportunity to get off of them permanently and restore the absorption of protein, calcium, minerals, B12, all those things that you're not getting a whole lot of because of. Give our office a call, 703-698-7117. Love to have you. Please be our guest. And we want to remind you that, and to encourage you to help us, help others, the Roselle Center for Healing is sponsoring the Have a Heart campaign this week only, the 6th of February through the 11th of February. What we're doing is simply this, is we're exchanging our services of consultation examinations for those of you who have never been to our practice for $50 or a bag of groceries, whichever you'd like to do. We recommend a value of at least $50. Our normal examination charges start at $225 and up. And what we're going to do for that is we're going to triple play it. For every $50 that you donate to us, up to $100, Roselle Center for Healing and Caring for Others and myself, Dr. Tom, are going to match it. And we're going to give it to Food for Others, which is one of the shelters that distributes food throughout the area. It's time. I mean, we really have to do something because people are starving out there. They truly are. You would think in the metropolitan area that wouldn't be the case, but it is. Help us, 703-698-7117.
So, Tom, you're saying it's $50 plus additional $150.
Yes.
That's $200 going to...
Yes.
That's amazing.
Yes, per person. So Caring for Others is stepping up to match it. I'm going to step up to match it, and Roselle Center for Healing will step up to match it as well. So we're going to do everything that we can. Please help us, help others. All you need to do is call our office. And as well, if you'd like to attend Dr. Scott's class. Got a couple more calls we're going to get to, but let's talk a little bit more about Gerd. And, we've been bashing this all morning or all afternoon so far. But the truth of it is that the majority of these problems can be turned around. Without drugs, without anything else, you can fix it. Very much so. And I think, again, you're looking at, we're looking at our triangle. How do you handle stress? There's a structural component, as being an aspect of working on where we talked about the diaphragm. We've talked about the aspect of the psoas muscle. We've talked about possibilities in the neck. We've talked about the hiatal hernia. Those are structural things that could be done and fixed and worked with. There's the chemical aspect and working on the chemical so you're not supplying it. I think we didn't really talk about allergies. But allergies could also make this thing worse. Oh, allergies is one of the primary culprits in a GERD problem. Yeah, and so allergies, and you're going to find those out. And in our office, we actually go through and find those things, and especially, things like grains and those kind of things can be major problems. And turn them off and desensitize them. I'll refer people to our YouTube of Ray Lynn, who we treated last year, a girl who was suffering from all kinds of allergies, to such an extent that she would go in anaphylaxis and she would go into seizures weekly. And she was living with an EpiPen and had to go back and forth from the hospital. From the time she was 8 years old, she was 17 when we started treating her, and she is now a student in college, doing well, does not have any more problems, off of all the medications that she was on, and she's seen the best in the country. This stuff works. She was on the internet, wasn't she? Isn't that in the internet? You can actually take a look at that? Yeah, you can go. You actually can go into either RoselleRadio.com. I still think we have it linked to our website, and you're going to see a charming little redhead there. If you go to Roselle Radio or Dr. Tom Roselle Live or Roselle Center for Healing, we're trying to get them all linked into one area now, and you'll see on the right-hand column there's a picture of a YouTube or internet linkage that you click on that. It takes you right into the MTV presentation without the commercials, with all the distractions, and you can see that. Okay. There's another thing we haven't really talked about. We talked about the decrease of acid not absorbing certain things. The other thing is the infections, the candida overgrowth. There's certain things. Part of our system, the acids are there, not only supposed to break things down into small little bits, but it's to sterilize the gut as certain things come through.
And viruses and bacteria can get in the system. You can get an overgrowth of Candida overgrowth. You can get fungal problems. That if you don't have that, that's, again, your first line of defense. And if it's not there, then you're going to get systemic possible problems. And like H. pylori, we haven't talked about that particular person, or bacteria, I should say.
Yes, it definitely affects the person.
It's a bad person.
It is a bad person.
And basically what happens if the acid levels are not strong enough, this thing likes to bore a hole, and then all of a sudden you get some gastric ulcers that can happen from this. And this is a nasty little bug, because what happens, it produces ammonia that actually kind of buffers itself against the stomach acid, and it really starts, they come with an antibiotic and the treatment protocols that come through when this thing sets in. But the reason why it got there in the first place is the acids weren't there.
There's an interesting situation. People are complaining to their doctors that they can't sleep because they have the burning, and they put them on the protein pump inhibitors, and then they can't sleep because they're blocking things like melatonin and tryptophan and B12 and all of those things that allows us to sleep. And, it's like what's worse, the treatment or the situation. Obviously, from our point of view, the fire can be put out, so to speak, and in fact, this Wednesday evening, the 8th of February, Dr. Scott Lamp will be your presenter at the Roselle Center for Healing. We're going to talk about Gerd and any of those stomach problems, and I think you're going to find that the fix, if you're willing to step up to the plate, is something that you can do. If you'd like to attend, and please be our guest, we'd love to have you there, 703-698-7117. That's 703-698-7117. Been listening to Dr. Tom Roselle live. We've been in studio at 888-630-WMAL. We're here every Sunday at 12 o'clock to answer your questions and to give you a little controversy relative to what you're doing, what you shouldn't be doing, and being able to put the fire out on your stomach problem. Dr. Scott, we were talking just before we went off the air, but this is a problem that is unfortunately affecting huge numbers of people. Gastroesophageal reflux, according to the medical profession, and we have our position relative to its diagnosis and misinformation.
Yeah, we're talking about roughly, I've seen 35 million people to half the population with this. And again, if we want to get healthier and better, we got to break, and that's what really gets me. In the very beginning of when we're trying to digest things, we've got to be able to break those foods down. We be able to get the nutrition. Even if you're trying to help other parts of your body and you want to feed the nutrition to it, it's got to get broken down in the stomach. If it doesn't happen there, maybe some of your nutrition just goes right out the pooper.
Well,
it's gone.
Truly, literally. It's gone. Nothing gets absorbed in your body.
Right.
If you don't have acid, you can't fight microorganisms that are coming into your system. You can't destroy them. That's your body's first line of defense. So when you're knocking that out, ladies, you become much more prone to osteoporosis. And if you're on your way already because you're not getting the things that you need in your body or you're messing up your hormones, the intestinal tract is your primary producer of many things, serotonin and GABA, all brain hormones.
Mm-hmm.
We think it's the brain, but it ain't so. It's coming from our gut's ability to work the way it's supposed to work.
Yeah, there's a book out there called The Second Brain, and he was talking about the basic aspect. There's more nerve endings coming out from the stomach digestive aspect than from the spine.
This Wednesday evening, Dr. Scott Lamp will be your host. Please join us at 7:30. Give my office a call, 703-698-7117. Doug, how can I help you?
I have a cold right hand and right arm, and I wonder if it's the circulation or what can be done. My personal doctor couldn't tell me anything.
Doug, how long have you had the problem?
Just recently. I don't know how long, maybe a month.
Okay, the likelihood of it being circulatory as it's affecting one side of your body, only one extremity, is not significant. It's probably a pinched nerve in your neck that's causing problems within the muscular system, so you're getting a pain, an ache, a throbbing, a dullness that has to do with where that nerve comes from. So you have to look at any problematics, but if that's it, that's remediable. That's something that can be fixed. But the diagnosis is one of testing muscles and then finding out if a muscle's weak, the nerve root that's attached to it. For example, your bicep muscle in your arm.
I tore my bicep muscle a couple of times already.
Okay, that's cervical 5. That's the 5th nerve root in your neck. And if your thumb and your pointer finger, your index finger is involved, that's cervical 5 as well. If your little finger is involved, that's usually cervical 7, maybe the first thoracic vertebrae, the upper or one in your back. But that's where you look to begin with. You don't look at it's like my old saying, if you hear hoofbeats, look for horses, not zebras. Look for the thing that's most common, and generally with the things that's most common when it's this type of problem that you're presenting with it's neurological. Doug, if we can help you in any way, please give us a call. We'd be more than happy to talk to you about it. Scott, we've got a few minutes. In about 20 seconds, tell me what you're going to do Wednesday night.
Well, Wednesday night we're going to talk about what the problems are, what the typical symptoms you see. We'll give you actually a questionnaire to kind of fill out, and we'll actually give you some of the solutions. If you're tired of the drugs and medications that you're on, this is an opportunity for you finally, forever, to change your life, to get your health back, to regain some of the things that you've lost over a period of time. Trust me, it's going to be worth attending. 703-698-7117. We're here every Sunday, 12 noon, bringing you the most cutting-edge information in integrative care. If you'd like to talk to us off-air, you know how to find us, RoselleCare.com. This is Dr. Tom Roselle. See you next Sunday at 12.